Every single time you flush, you're throwing away a report. Your body writes it for you every single day before your blood work ever shows anything, before you feel a single symptom. Most people just never learn how to read it. They glance down for half a second and flush, and whatever message was sitting there is gone. Today, we're going deep on 10 signs your stool gives you. By the end, you'll know exactly which ones are genuinely important, which ones you can safely brush off, and more importantly, what's actually happening inside your body when each one shows up. Think of your gut as a factory. Your digestive system is essentially a long tube, a processing line. Food goes in one end, and along the way, it gets broken down, nutrients get pulled out and absorbed into your bloodstream, and whatever's left over, the waste, gets packaged up and shipped out the other end. At every single stage of that process, something can go slightly wrong, and when it does, it leaves a trace in the final product. The color can shift, the texture can change, things that shouldn't be visible become visible, the timing and frequency can speed up or slow down. That makes your stool one of the most honest, most immediate diagnostic tools available to you. Completely free, completely automatic, and updated daily. You just have to know what you're looking at and know the difference between this is your body sending a real signal and this is just what you ate for lunch. Let's go through them one at a time, starting with color. 1. Pale or clay-colored stool. Normal, healthy stool is brown. That color comes from a compound called bilirubin. Here's how it gets there. Your red blood cells have a lifespan, and once they've outlived their usefulness, they get broken down. That breakdown product travels to the liver, gets processed further into bilirubin, and the liver then dumps that bilirubin into bile, which eventually makes its way into your gut and colors your stool brown. So when stool comes out pale, almost clay-colored or grayish, it tells you that bile, and the bilirubin inside it, isn't reaching your intestines the way it should. It's getting stuck somewhere upstream. What can cause that blockage? A few things. Gallstones sitting in the wrong place, an obstruction or blockage in the bile duct itself, or certain medications interfering with the process. Cholesterol-lowering drugs, tuberculosis medications, some antibiotics, and chemotherapy drugs have all been linked to this. When should you actually worry? If it's persistent, meaning it lasts several days in a row, or keeps coming back over a couple of weeks, that's not something to shrug off. Same goes for if it shows up alongside other symptoms like unexplained weight loss, abdominal pain, or fatigue. A single pale stool after a weird meal is one thing, a pattern is another. 2. Black tarry stool. This one requires some nuance because dark and tarry are not the same thing, and mixing them up leads to a lot of unnecessary panic, or worse, ignoring something real. A true tarry stool is black, sticky, clings stubbornly to the toilet bowl, and has a distinctly foul odor. Medically, this is called melena, and it happens when blood has been digested on its way through your system. The location of the bleed matters here. If it's an upper GI bleed coming from the stomach, the esophagus, or the upper part of the small intestine, that blood has a long journey ahead of it before it exits your body, which gives it plenty of time to be broken down and turn black. Now, the harmless side of the equation: iron supplements, Pepto-Bismol, and foods with a lot of black pigment. Think black licorice or activated charcoal can also turn your stool very dark. The key differentiator is that these won't be sticky or foul-smelling. If it's just dark and nothing else, it's probably one of these benign causes. There's also a sneakier version of this problem I want to flag. A slow, chronic bleed that's happening so gradually that it never actually changes the color enough for you to notice. It's not enough blood at once to darken the stool, but over weeks or months, that steady, low-grade loss can add up and lead to iron deficiency anemia, especially in menstruating women who are already losing blood monthly. The tell here isn't stool color at all. It's symptoms like fatigue, weakness, unusually pale skin, or getting winded climbing a flight of stairs you'd normally handle fine. If that's ringing a bell, the fix is simple. A basic CBC, complete blood count, blood test will catch it. 3. Bright red stool. Red means the blood is fresh. It hasn't had time to get digested, which tells you the bleeding source is close to the exit. Think hemorrhoids, an anal fissure, or bleeding in the rectum or lower colon. There's also a useful clue in where exactly you see the blood. If it's on the toilet paper after you wipe, that points more toward hemorrhoids or a fissure. Surface level irritation near the anus. If the blood is actually mixed into the stool itself, that suggests the source is a bit further up, somewhere in the lower colon or rectum. On the harmless side, beets, tomato-heavy meals, and red food dye can all tint your stool red, but this takes a real quantity. We're talking an entire day of beet soup or tomato-based dishes, not a small side salad. A little garnish isn't going to do it. As always, the rule holds. Occasional and mild is usually nothing. Persistent, large amounts, or blood combined with pain or other symptoms means it's time to get checked. 4. Yellow, greasy stool. This one usually announces itself with a strong, unpleasant smell in addition to the color and texture change. What's happening here is that fat isn't being properly absorbed and is passing straight through, a condition called steatorrhea. There are a few possible root causes. You might be low on pancreatic enzymes, particularly lipase, which is responsible for breaking fat down in the first place. You might have reduced or blocked bile flow, which normally helps emulsify fat so your body can absorb it. Or in more serious cases, it could point to celiac disease, where the intestinal lining is so damaged that it struggles to absorb almost anything properly. One important distinction, this usually isn't diet-related in the way people assume. Eating a very fatty meal doesn't typically send that fat straight into the toilet. Your body is generally good at handling that. The exception is celiac disease, where the actual dietary trigger is gluten, not fat itself. If this shows up once after an unusual meal, it's probably nothing. If it's a recurring pattern, it's worth having it looked at. 5. Floating stool. There are two main explanations here, and they're pretty different from each other. The first is leftover fat, which we just covered above. The second is gas produced by fermentation in your gut, and this one is often much less concerning. Gas-related floating is frequently just a diet shift. Maybe you ate more fiber or more carbs than your usual routine, or ate different types of plant foods your gut isn't used to processing. That's typically harmless and temporary. But there's a version of this that points to something more significant, an imbalance in your gut bacteria, sometimes called dysbiosis, or a more specific and increasingly common issue called SIBO, small intestine bacterial overgrowth. Here's the short version of why that matters. Your gut bacteria are supposed to live primarily in your large intestine, where their job is to help break down fiber and plant compounds your body can't digest on its own. With SIBO, those bacteria end up colonizing the small intestine instead, the part of your gut that's supposed to be absorbing nutrients, not fermenting fiber. The result is often severe bloating pretty much any time you eat fiber or carbs. A quick way to tell the two apart: if there's a strong, foul odor along with the floating, it's more likely fat. If the smell hasn't really changed from your normal baseline, it's more likely just gas. 6 to 7. Too hard or too loose. To talk about stool consistency properly, it helps to use the Bristol stool scale, a widely used medical reference with 7 categories: separate hard lumps, like small balls, difficult and often painful to pass sausage-shaped, but lumpy and hard on the surface, sausage-shaped with visible cracks on the surface, smooth, soft sausage shape. This is the ideal soft blobs with clearly defined, clean edges. Passes easily. Fluffy pieces with ragged edges, mushy consistency, entirely liquid, no solid pieces. True diarrhea, types 3, 4, and 5 fall within a healthy range. No cause for concern there. The two extremes on either end are where we need to pay attention. Too hard. Types 1 to 2. This tells you transit time is too slow. The stool is spending too long in your colon before it comes out. The problem with that extra time is twofold. First, more water gets pulled out of the stool, which is what makes it hard and painful to pass. Second, and often overlooked, toxins and waste products that were meant to be eliminated get reabsorbed back into your system the longer they sit there. Common causes include a low-fiber diet, dehydration. Remember, you need water to actually move fiber through your system, not just fiber alone. Low physical activity. Movement stimulates peristalsis, the muscular contractions that push stool along. A bacterial imbalance that reduces production of short-chain fatty acids, and an underactive thyroid. That last one is worth explaining. Your thyroid acts like a thermostat for every cell in your body, controlling how fast your metabolism runs overall. When it's sluggish, your gut slows down right along with everything else. Certain medications can also cause this as a side effect. And beyond the discomfort, straining hard and frequently to pass hard stool can lead to hemorrhoids, bleeding, and a lot of unnecessary time spent on the toilet. Too loose, types 6 to 7. Here, transit is happening too fast, which means water gets carried out along with the stool instead of being reabsorbed properly, creating a real risk of dehydration if it continues. Common triggers include infections. Your body is essentially trying to flush out the problem as fast as possible. Food intolerances, and stress. If this is occasional, it's usually nothing to worry about. Virtually everyone has eaten something that didn't agree with them and been fine the next day. But if it becomes chronic or frequent, that pattern points towards something like IBS, irritable bowel syndrome. Often linked to stress, anxiety, or an overactive nervous system, or IBD, inflammatory bowel disease, which includes conditions like Crohn's disease and ulcerative colitis, and often has an autoimmune component behind it. 8. Excess mucus. A thin, clear coating on your stool is completely normal. Your large intestine naturally produces a protective layer of mucus that lines the gut and helps stool pass more smoothly. That's not a problem. What is worth paying attention to is excess mucus, the kind that's clearly visible, maybe floating on the surface of the water, especially if it shows up alongside blood or other symptoms like abdominal pain. This kind of mucus increase is commonly associated with IBS, IBD, including Crohn's disease and ulcerative colitis, celiac disease, or an active infection. If it appears for a day or two and then resolves on its own, it was likely something temporary, like a minor infection your body cleared quickly. If it's frequent or persistent, that's a signal worth getting checked out properly. 9. Undigested bits of food. Almost everyone has noticed small bits of corn, seeds, or bean skins in the toilet at some point, and a small amount of this is completely normal. There's certain fiber your digestive system simply isn't equipped to fully break down, and that's expected. The concern comes in when it's large pieces, large quantities, or if the particles are greasy in addition to being undigested. That combination points to a problem further up the digestive chain. It could mean low levels of stomach acid, hydrochloric acid, which is needed to properly break down protein and absorb minerals. It could point to low pancreatic enzyme levels, meaning your body can't fully digest protein, carbohydrates, or fat. Or it could point back to a gut bacteria imbalance, since it's your microbiome, not your own enzymes, that does most of the heavy lifting in breaking down fiber and plant material. An occasional change here, maybe you just ate more or a different type of fiber than usual, isn't a big deal. But frequent occurrences, large amounts, or accompanying symptoms like weight loss, fatigue, or bloating are worth having evaluated. 10. Changes in frequency. This is the one people misunderstand the most. Being regular doesn't just mean going at consistent intervals. Going like clockwork once a week is regular in the sense of being predictable, but it's not actually healthy regularity. The medically accepted normal range is 3 times a day to 3 times a week, but that's a spectrum, not a flat statement that anywhere in that range is equally fine. As you get closer to the 3 times a week end, you're really moving out of a comfortable green zone and into more of a caution zone, especially if the stool isn't well formed. If you're eating 3 solid meals a day with plenty of fiber, going 3 times a day and being well formed is completely normal and healthy. But if you're only going 3 times a week, that means food and waste are sitting in your colon for 48 to 72 hours at a stretch. During that time, things your body was actively trying to eliminate have extended contact with your intestinal lining, and some of that gets reabsorbed instead of leaving your system. Realistically, aiming for at least once a day is a better target. Increasing fiber, water intake, and physical activity are the first things to try. Though if you're already drinking plenty of water and finding yourself needing the bathroom to urinate every hour or two, water clearly isn't your limiting factor, so look elsewhere. The real signal to watch for is a sudden change relative to your own normal baseline, either direction. An increase in frequency can point to infection, a food reaction, an overactive thyroid, the opposite of the sluggish thyroid we talked about earlier. This speeds everything up instead of slowing it down, or IBS/IBD. A decrease in frequency, or constipation can point to insufficient fiber or water intake, an underactive thyroid, or medication side effects. This last category is extremely common and worth knowing about. Opioid painkillers are notorious for causing constipation, almost reliably. And increasingly common these days are GLP-1 weight loss medications. GLP-1 is actually a natural hormone your body releases when you eat, signaling fullness and slowing digestion so your body can process food properly. These medications mimic that fullness signal artificially, even though there's no food actually driving the process, which means they slow gastric emptying and overall gut motility. In more severe cases, this can progress all the way to gastroparesis, where the digestive tract's movement essentially stalls out almost completely. The rule that ties all 10 of these together is simple. Pay attention to sudden, unexplained changes that stick around for more than a couple of days to a couple of weeks. A single off day after a strange meal isn't a crisis. Your gut deals with variability all the time. But a real pattern, especially one paired with pain, unexplained weight loss, or persistent fatigue, is your body asking you to actually listen. You get a fresh report every single day. Learning to read it properly might be one of the simplest, most underrated health habits you can build.